Good evening, folks. This is another Q&A where you can ask all kinds of questions about your issues with molds and mycotoxins and other medical things as well. I welcome your questions and I will answer them as they come in. So let us begin. I have a question here. Hi, Dr. Campbell. I am wondering if you could expand on given binders don't work to remove mycotoxins, what in your protocol or the body's mechanism to remove mycotoxins? Okay, so first of all, let me express to you that the following thing that is very important, and that is that in medical school, I was taught, in God we trust. Everyone else has to show data. So if you look at the published studies on binders, they work fine in animals, sheep, rabbits, goats, fryer chickens, piglets, etc. There are 3 studies on binders in humans, and they all say the same thing. The 3 studies say they don't work in humans. So why would anyone take something that doesn't work? The treatment is pretty straightforward, and again, it's based on medical evidence, and it's in my YouTube channel. You can go to it, you can see the treatment, how it detoxes the body, and it does not include cholestyramine and other myth kind of medications that have no effect in humans. So, on another point, in all the international people living in other countries other than the United States, it's difficult to find supplements and vitamins that have a great quality. What do I mean by that? There's 2 studies that were published, one in 2023 and one in 2024. The first one showed that out of the 60 most purchased supplements, they took these 60 supplements to the lab and tested them for what's in the bottle and what it says on the label they contain. 11% had in the bottle what it said on the label. 40% had nothing in the bottle that it claimed on the label. So that's a difficult situation for those who are in international areas. The other one, the study that was published in 2024, showed that they took all these supplements to the lab and tested them for 2 things: heavy metals. What do I mean? Mercury, arsenic, lead, cadmium, etc., or pesticides. 93% had or heavy metals or pesticides or both in the tablets, capsules, etc. that they had. So that's the situation. I have another question here that started that says, I've been on 200 milligrams of itraconazole for 4 weeks, still having heavy head anxiety and depression. Tried many antidepressants that just don't help. Is itraconazole effective in treating these types of symptoms? Most people affected by molds and mycotoxins have been affected for years, not just a few months, years. Do not expect anything to work within just 4 weeks if you've been sick for years. Second, many people affected by mycotoxins are depressed and have anxiety, and medications do not work. This has been published in studies after studies. Many psychiatrists send their patients blood serum to MyMycoLab, when they're positive, they treat the mycotoxins, and then the depression and anxiety goes away, but not in just 4 weeks. It takes 2 to 3 months before the effects are starting to be felt. The whole treatment takes 6 months. So, hi doctor, I'm on medications that are not compatible with itraconazole. It's high alert, cannot be taken with itraconazole. What are the other options other than itraconazole that can be taken for? There are certain medications and drugs that you cannot take. Principally, those are 3 types. One is antidepressants. Second, anxiety medications. And third, medications for circulatory problems. And unfortunately, there is no other solution for those kind of problems. And what I found, what you have to understand is that these mycotoxins cause anxiety, cause depression. It's not you, it's them. Once you get rid of them, everything goes away with the treatment. It takes a while. It's not quick. And if you look at the color of my hair, I've been doing this a long time. So I understand all the problems that you're going through. Believe me, I do. I've seen not thousands of patients, tens of thousands over the last 35 plus years. So it's a situation where the medications you're taking are because you have something from mycotoxins. Mycotoxins affect blood, they affect bone marrow, they affect kidneys, they're toxic to bone marrow, where blood is made. They're toxic to kidneys, they're toxic to the liver, they're toxic to the brain and nervous system, they're toxic to the skin, they change DNA, they change RNA. So it's the treatment for molds and mycotoxins, and then you don't need any medications. Do you accept and work with new patients via Zoom, or do we need to fly to Guadalajara to get my teenage son with you? In general, I am backed up, as you can imagine, for a long time. There are 2 clinics that I have outside the country, and one is in Guadalajara, Mexico, and the other is in Istanbul, Turkey. And it is easier to make an appointment with me in Guadalajara or Istanbul because I'm there every month for a week and each place, and you can make appointments there. Just shoot me an email and I'll respond, and then you can do whatever you need to do. I want to bring to your attention this issue that comes up time and time again because of all the misinformation in social media and Dr. Google and Dr. Facebook and other places. I wonder what is going to happen to a person who's having acute appendicitis or a stroke or some other thing. Are they going to go to Dr. Google or Dr. Facebook? What should I do? No. So the issue is this: binders don't work and don't help. Second, there's a lot of talk about parasites. Where do you get these parasites? And incidentally, if you go to MyMycoLab's YouTube channel, I did all these videos on heavy metals, ivermectin, etc., that people are taking thinking they have this, that, and the other. Where do you get parasites from? Eating raw seafood. Very simple. And this has been, and I show in those videos studies that show where you get these from. Let me say something about another thing, and this is because people who have no idea, who do not do what I do, which is, in God we trust, everyone else has to show medical evidence. Lyme. There's only one laboratory in the United States that does an acceptable Lyme test, and that laboratory is Immunosciences Laboratory in Los Angeles, California. The other 2-3 labs are not acceptable. PCR, Immunoblot, no, they're not acceptable according to published studies with clinical trials to back them up. And what is the treatment for Lyme? You hear all these stories about how it takes months and years. Medical evidence and scientific evidence have shown that it's 2 weeks treatment or 3 weeks if it's in the brain. That's it. All right, let me answer some questions. Do you recommend getting Lyme tested after your mycotoxin test? I would do the mycotoxin test treatment, and then if you're feeling fine, you don't need the Lyme test because you feel fine. Since you can test mycotoxin antibodies in the blood, should I avoid donating blood? Absolutely. If you live or work or are exposed to moldy areas, don't give blood. Do the MyMycoLab test, get treated. My gosh, I have 30 or 40 videos you can look at and have every one of your question answered. And you're well again. You're back to your old self. And also, let's say you live in a moldy place and you can't move, or you work in a moldy place and you can't quit your job. That is a huge problem because these are toxins. Among other things, several mycotoxins are carcinogenic. Do you want that in your life? No. I had the house remediated and passed post-inspection, but found mold on door that removed. Can I continue on itraconazole and small amounts of spores still allow me to heal? I am not a building engineer. I'm a medical doctor. There are 2 videos I did with Brantley May, a building engineer. They're on MyMycoLab's YouTube channel. He goes through all these questions for you. Hi, Dr. Campbell. Thank you for taking the time to help all the reasons for not drinking coffee while doing your protocol because of mold and caffeine. Where do you get that? I'm so sorry. That is not what, that is maybe social media or some other things. That is not medical and scientific evidence that coffee or anything like that affects you. Test if you are taking an immune suppressant, something that suppresses your immune system, like prednisone, cortisone, these drugs, you have to wait 8 weeks before being tested. Let me give you an example. 1 milligram of prednisone suppresses your immune system for 24 hours. You don't want those kind of things. You want a healthy body. All these immunosuppressants, all they do is sweep the symptoms under the rug. The minute you get off of them, everything comes back. You're not being cured, you're being treated for symptoms. I like to cure people, not treat them, cure people. I want to tell you a story of one of my patients. And she was kind enough to let herself be interviewed, and her interviews are on social media, Instagram. This is a young mother. She's married, has 3 little kids. And what happened? She was feeling bad. She went to the doctor. The doctor sent her to a neurologist. The neurologist said, I think you have multiple sclerosis. He did an MRI, and on her MRI, there were 10 areas of white spots showing demyelination. And he says, I'm so sorry, you have multiple sclerosis. It's not curable. She came to see me. I treated her, and she was fine. And then her neurologist, after 1 year, said, you have to come back because it's been 1 year since we did your MRI. They repeated the MRI. And what did they find? Nothing. It was clear. There were no spots, nothing. He was shocked, but she was happy. And she is so glad, and this is why she did this wonderful video. So, does citric acid have mycotoxins in it? Depends. You'd have to show me more information. What happens if a patient does the 6 months protocol as you describe and still has symptoms after the 6 to 8 months? Our son has become extremely sensitive and symptomatic through years of treatment. The last video I did was, why and when does treatment not work? So please go and watch that video, and it'll tell you and explain to you the whole thing, and you will understand it perfectly. On itraconazole, not eating bread, sugar, etc., but concerned I'm not eating enough. Will this affect how effective itraconazole is? No, it will not. Itraconazole is a very safe medication. Remember, folks, in my videos, I show you the studies, published studies on how safe itraconazole is. So if you go to social media and they say that your hair will fall out, your eyeballs will fall out, your teeth will fall out, your liver will disappear and go away, and all kinds of things, in God we trust. All others have to show data, medical evidence. I show you the medical evidence. That's what I do to help you. My primary doctor won't prescribe itraconazole for more than 7 days. He claims it's too damaging. Yeah, he doesn't know. He's probably never prescribed it before. 7 days? Excuse me. Watch my videos and watch all the studies, the published studies that show it's completely safe. Actually, in medical textbooks, they say it's safe for 12 to 18 months. And your doctor says 7 days? I guess he doesn't read his books on medicine. Can mycotoxins cause unexplained tremors? Yes. Very common. Actually, there's a mycotoxin that causes tremors. It's the mycotoxin made by penicillium mold. And it's one of the mycotoxins tested for by MyMycoLab. Does the use of PPI for Barrett's affect the treatment? Let me explain to you the medical aspects of PPIs, proton pump inhibitors, PPI. The companies that produce them say they should be taken no more than for 2 months. So if you've been taking it for more than 2 months, if the company that makes them tells you no more than 2 months, what's wrong here? You may be having a problem caused by the mycotoxins on your esophagus. All right. There's a question here, is gliotoxin anything else? So I can't answer that. Does mycotoxins cause arthritis symptoms, or is it the result of MCAS? Mycotoxins, and I show in my videos pictures of people who had rheumatoid arthritis, and after 6 months treatment, they're well. Photographs, they show you, so you can compare it. Yes, mycotoxins do cause autoimmune disorders. That's well known and well established in medicine, and medical journals have discussed this over and over again in many, many studies. It's not MCAS, it's not mast cell activation syndrome. Do I have to take itraconazole on a full stomach? Will it work if not taken with a full stomach? Forget the full stomach. It absorbs faster if you have some food in your stomach. It's taken twice a day, morning and evening. No, for breakfast, you don't need to go to Denny's and have the grand slam breakfast with I don't know what. You can have yogurt and some fruit or something. That's all it needs. It's only to help it absorb better. Are there SPECT scans out there that show mold toxicity the same way you can see TMI SPECT scans usually look? Yes. I'm about to test my daughter for mold toxicity through MyMycoLab blood test. I suspect the blood test will come back positive for mycotoxins. Can she be treated by you? If there's a slot available, I can treat her. Sometimes people make appointments and they cancel for some reason. So, and I don't know, like most doctors, I don't know my schedule. My staff knows my schedule more than I do. How often do you find sensitive patients go through your 6-month protocol and don't get healed and cleaned of symptoms like constant forehead headache and mental physical exhaustion? I address this in many of my videos. What about the sensitive patient? Those are the ones who are on 20, 30, 40 or more supplements for a long period of time, who use the wrong treatment and they become sensitive. They're so sensitive, they can't walk down the aisle at the supermarket where there are the soaps and detergents because the odor makes them sick. What I do is I help detox them, and watch my videos on the sensitive patient. I explain it all there. How do you deal with gut microbiome damage caused by mold? Well, just 3 months ago, I did a whole video on how to detox and help the gut, the whole gut. So if you watch that video, it'll explain it all A to Z. It would take me 30, 40 minutes here to explain it all, but there you can watch it. Again, damage from antibiotics. All these patients who take antibiotics for months and months and months for Lyme disease, my gosh, their microbiome is destroyed. And I've seen so many of those patients, but within a few months, they're healed. Is the compounded version of itraconazole from compounding pharmacy just as effective? I don't know your compounding pharmacy. What I can tell you is itraconazole is a generic medication. The great majority of generic medications are made in India or China. And sometimes you have to change from the generic to the name brand Sporanox so that you don't have symptoms. Does the body have good fungi like it has good bacteria, and does itraconazole affect the good fungi if it exists? No. My daughter has no Akkermansia. Could this be from mycotoxins? She is 5. That's another one of these, in God we trust. All others have to show data. Do the MyMycoLab test. You get a complimentary Zoom call to go over your results. That will help you. Do you train other doctors in your protocol? Obviously, you'll want to retire at some point. So who will carry on your work? I train doctors all the time. Today is Wednesday. I'm flying to New York City tomorrow morning, and I'm speaking at the Integrative Health Symposium teaching doctors on Saturday. I do this every month, at least once, sometimes twice. And this particular month, I'm doing it twice because I'm going also to Charlotte, North Carolina. My feet hurt badly and edema in my ankles. I had the MyMycoLab test, and it's not pretty. That's more a statement than a question. Well, I don't know if you had your complimentary Zoom call or what happened, but obviously if it was positive, you need treatment. And with treatment, you get well again, not you get better. I don't go for better. If you have a pneumonia, I don't want you better. I want you healed, etc. If you finish a course of itraconazole, but then are re-exposed to mold, can you do another course? That's a very good question. Let me tell you what my patients have told me over the last 30 some odd years. They'll tell me, I took your treatment, I was well again, and I went to visit a friend at her apartment or home. I went into a restaurant, I went into a shop, a store, and within 5 to 10 minutes, I knew I had to leave. That is your body telling you, get out of there, there's molds and mycotoxins. So you may not need a whole course. No, if you just got exposed because you spent a weekend at a hotel or a motel or something where there was mold. No, your body will, once your treatment is through, your immune system is back to where it should be. And that will help you get rid of any kind of toxins. Vibrant Wellness Labs for mycotoxins, Lyme, any good? Urine test? Are you measuring what's left the body? No, that's no good. You need to know what's in the body. Why do you think that the FDA and the CDC have not validated the urine testing? Because it's not of any value medically. My 15-year-old daughter has been sick for almost a year. It started as a cold, and the same time we discovered a bathroom leak. She has morning blackouts and is diagnosed with MCAS. No explanation. Do the testing with MyMycoLab and have your complimentary Zoom call. MCAS, mast cell activation syndrome, can be caused by mycotoxins and can be treated and gotten rid of. It's not difficult. Any other questions, folks? I'm here for you to answer them based on medical and scientific evidence, not hoopla, hoolala, or whatever is said on Dr. Google, Dr. Facebook, and other social media. So remember, I rely on medical and scientific evidence. And why have I been successful and have cured tens of thousands of patients and published over 100 studies in medical textbooks? in medical journals, etc. Thank you. Who do people work with if you aren't available? Well, that's a good question. I have patients I have doctors throughout the world that I've trained, not only in the United States, Canada, Mexico, Dubai, Europe, Australia, New Zealand, and etc. Just email me and I'll tell you. I can recommend those also who do virtual medicine online like this. Thank you for your protocol. I've been exposed to mold via hidden leaks for decades. I've been tested and I'm allergic to aspergillus. Please advise. Okay, you took a test for allergies? We're talking toxins. Toxic molds produce toxins. Toxins are molecules. You need to be tested for the toxin, not the allergy. Will the treatment with itraconazole work for someone with years of exposure to mycotoxins? My test with MyMycoLab came positive for both past and present. Absolutely. You get well again. You're fine. You're back to your old self. After treatment, what not to eat? Well, what do you think? I don't think people should eat certain things. I don't think, soft drinks are that good for you, etc. So use common sense. Be careful with what you eat. Your diet is very important for your general health to begin with, even if you're not sick. You know that. I had the call today, actually, dealing with trying to remediate our home. It's not cheap. Well, no. It's unfortunately not cheap to get rid of molds. I understand that. And I empathize with you. But we're here to help you. I'm here to help you get through all that. Do you suggest a company to confirm if the bedroom is cleared out of mold and mycotoxins? There are so many, not sure. Absolutely. I have found only one company I trust. And believe me, I have all these companies saying, can we put you recommended us on our website? I say, no. One company, envirohealth.co. Envirohealth.co. Have you had patients struggle with candida overgrowth after finishing meds? In general, if you have candida overgrowth, it's only because your immune system is affected by either some medication, like corticosteroids, etc. What are other sources of vomitoxin other than foods? Would you be able to add 2 extra bars to your mycotoxin lab test for the levels I had? Thank you. Well, let me explain to you. Where do vomitoxin, fumonisins, okay? We test for vomitoxin. It's also known as deoxynivalenol, and it's not from food. I show that in many, many, many of my videos. So if you just take the time to watch some of these videos, it'll explain it all to you. It's not from food. I'm just starting on the protocol post MyMycoLab test. Is it important to remove all dairy from diet? You have to talk to a nutritionist about this. And my patients, I'd say no gluten, no dairy, no soy, among other things. I also have a nutritional sheet I give to my patients. I'll share it with anybody. Do you think the vagus nerve has any relevance to healing? I keep hearing about this. Are you hearing it in social media? Are you hearing it from medical journal articles? Do you understand where I'm going? Hearing what people say. Oh, I did this and it helped me. Excuse me. Is that medical evidence? No. What I can tell you folks is that there are so many people affected by this that there are studies now being published that are saying this is a public health problem, because just in the United States, and I can mention other countries because studies have been done, there are so many structures. What does that mean, structure? Public buildings, offices, libraries, schools, apartments, townhouses, single family dwellings, etc., that have mold in them, that it's a public health issue. Any other questions, folks? I'm here to help you and give you the medical evidence, not the hoopla, not the yahoo. In addition to itraconazole, should also be doing nervous system regulation for being stuck in fight or flight. The treatment is not just itraconazole. There are 4 parts to the treatment. And this is all explained in my videos. Please watch my videos so you can understand it. I don't have an hour or two to explain all this. It's in my videos. I was reading through the Detox Pure Gut Protocol. Do you recommend a probiotic as well? It's part of the Detox Pure Protocol. Yes, it's in there. Do you suggest any air purifiers for bedroom? Okay, let me address this. This is a good question. Your hair, human hair, is about 100 microns thick. Mold spores are 2 to 4 microns thick. Mycotoxins are 0.1 microns, the same size as a COVID virus. If there were air purifiers that size, same size as a COVID virus, during the pandemic, the world would have been full of those purifiers. Get what I mean? I had your lab test. I need to know if there's anything I can do to lessen my symptoms until I can move out of the house. The house has been through a flood 10 years ago. Unfortunately, there is nothing you can do till you leave the area of where it is. Let me give you the first rule of toxicology. The first rule says, get the patient away from the toxin or the toxin away from the patient before you start any treatment. Can a pregnant woman pass mycotoxin to her child if she's been exposed? That is also a very good question, and it's the topic of one of my next webinars. Mycotoxins pass through the placental barrier and get into the fetus. Number 1. Number 2. At 90 days, obstetricians usually do an ultrasound. This ultrasound is to check. If they ever find an abnormality, they will do what is called an amniocentesis, remove amniotic fluid from your belly. 73% of cases with abnormalities contain mycotoxins, 3/4. The other part, mycotoxins in the fetus cause spontaneous abortion, cause problems with delivery, cause problems with small babies being born, fetal death, dying of the fetus, and the mother passes to her newborn child mycotoxins through breast milk. This is all from medical and scientific studies. Do you find there are areas in the USA that has less issues with mycotoxins in homes? No. Let me explain this to you. I was educated in Switzerland. When I was in prep school, my brother was at the university studying architecture, and he asked me, "What do you think of all this mold and mycotoxins?" I said, "Well, you're the architect. You tell me." He says, when we were kids, my parents took us to Amsterdam. He says, "You remember the buildings there? The top of the building, the houses, right next to the canals, and the whole country of Holland is below sea level. Right next to all these canals, there's these homes, and it says at the top what year they were built in: 1400, 1500, 1600, 1700. And why aren't they moldy? It rains. They're next to canals. There's water all around. Because they were made of stone. And nothing penetrates stone. It only grows on the surface. You wipe it off and it's gone. What do we use today? Cinder blocks. Have you ever sprayed water on a cinder block? It gets wet. Bricks, they get wet. Wood gets wet. Drywall gets wet. So all these things help mold growth, and these molds produce mycotoxins. Now do you understand that? So I have patients from Arizona. Have patients from the Coachella Valley in California. It's not weather, it's construction. Let's take Dubai in the Middle East. It's surrounded by desert. You leave Dubai, it's Lawrence of Arabia. Would you believe it rained there so bad that the rain was above the level of airplane tires and they couldn't take off? So think of that. If melatonin giving night terrors, can it be skipped from the detox protocol? It's in the detox protocol. If it's from detoxpure.com, you should take it. If it's not, if it's from some other source, no. Do you think having poor sleep would block my healing from mycotoxin? Sleep is terrible. Wake up after 4 hours. Absolutely. Sleep is so essential for the body to heal. And this is why the detoxpure.com kit comes with what you need to detox. It detoxes not only from mycotoxins, but heavy metals or any other toxins. Hello, any recommendations on machines that remove mold and mycotoxins at home? Thank you. There are no machines that do that, to my knowledge. Do you think in the future mold will be recognized as a serious toxin like asbestos? The National Institutes of Health in April 2025 on its website described mycotoxins and molds and how they affect people, including cognitive problems, etc. And if you look at the very end of that, those pages on the NIH website, they cite 16 studies that they got this information from. Study number 8 is the one I wrote and published in a medical journal. Do you think my insurance is willing to pay only for 100 milligrams a day? I'm so sorry. Insurance companies are there to make money off of you. They're not there to help you. And then, oh my God, I got poisoned in a cinder block warehouse. That's how this all started. Yeah. We got our high mycotoxin results on all 14 MyMycoLab tests. Should we start on detox pure recommendation protocol right away as we wait for the Zoom? Absolutely. Start detoxing immediately. What you can do. Why don't regular doctors acknowledge this? Very good questions. Why? Because patients come to them. I saw that binders work. You need to prescribe a binder. You need to prescribe me cholestyramine. You need to prescribe me this, that, and the other. You need to give me glutathione. Those things are not part of medical treatment. They're hearsay. They're for social media and those so-called experts who've never published anything. So doctors say, forget it. I'm not dealing with that. Does citric acid contain mycotoxin Aspergillus niger? You asked this question before and I answered it. I have bacterial pneumonia. Could it be from mold? Bacterial pneumonia is from bacteria, not mold. Can you get heavy metals out of the brain as easily as the body? It depends on which heavy metal, what level, etc. There is one test that I use for my patients for heavy metal, and that's DDI, David I, the letter I, Inc. Doctors Data Inc. in Chicago, and it's through hair analysis. Don't use urine or some other thing. Alrighty. Any other questions, folks? If glutathione is not advised for gliotoxin, would taking NAC also be problematic? Absolutely. And this is in my videos, which I've said many times this evening. You should watch because the information, and I give the studies from where they're from. It's not my opinion. My opinion matters hoot. What matters is what is medical evidence? What do studies actually show in many patients? So what do you think, folks? My purpose here is to educate, is to help you understand it, go by what's real, not what's all these Richies and Neils and Jills and all these things. Forget it. I go by medical and scientific evidence that show what works and what doesn't. Any other questions, folks? Almost done with 6 months treatment with the right diet, 8 specific supplements, but there's still symptoms, but they have gotten better since starting. Would I need a couple or more months of itraconazole? At 6 months is when a person should repeat their MyMycoLab test. So I would repeat the test and see what it shows and have your complimentary Zoom call. Angela, thank you for all you do. Thank you. Thank you for kind words. I appreciate them. Why are some doctors against phosphatidylserine? Because they don't read the medical studies. They rely on their opinion. Could dark tar-like stools be a sign of mold toxicity? Hair falling out, how to stop hair, all that? Absolutely. Watch my videos. They're all on MyMycoLab's YouTube channel. They're free. They go over, have maybe 30, 40 of them on different things so you can watch. Thank you. I listened to your videos for over a year. They are so needed by today's physicians, absolutely, and patients as well, who have all these. I mean, I really feel for many people because There's so much misinformation on social media from these so-called experts. What is expertise? Let me explain something to you. I've lectured at Harvard Medical School. I've lectured at other medical schools. I've lectured at Oxford University. Where have they lectured? How many studies have they I've published over 100 studies, and I still am publishing. My last study came out last month in January 2026. I'm still publishing. How many of they have published? They just opinion? Well, everybody's got an opinion, just like everybody has a mouth. Thank you for all you do. If I test positive for parasites and now for mold, which one should I work with faced? What is the power? There's only one acceptable test for parasites, and that's ONP. What does that stand for? Ova and parasite stool test. All the others are BS. They're easy to get rid of, very easy. Do the mold mycotoxin, you probably get rid of that too. Thank you for doing these. Have you ever seen anyone actually have serious side effects with itraconazole? In 36 years, 2 patients. One is a 43-year-old female who developed total insomnia. I switched her from itraconazole to Sporanox, and she was fine. And the other one was a 53-year-old male who developed gastric acid. I changed him from itraconazole to Sporanox, and it went away. I have both Lyme and mold illness, and mold is a million times worse. It's no joke, absolutely. I hope you did the Lyme test with Immunosciences Laboratories in Los Angeles, like I said at the beginning of this video. I will repeat the test at 6 months. My most debilitating symptoms were dizziness and brain fog, and even though it has gotten less severe and frequent till then, you think it's from something else. Hidden mold somewhere in your environment. May not be your home. It could be your car. It could be your workplace. It could be your gym. It could be where you go to visit a friend or a club or do something. Not necessarily your home. Any other questions, folks? Here to educate and help you. All right. Well, it looks like we're done here. I hope I've helped you. Watch my next video. It's coming up. Folks, I hope you get well. Watch my videos. They help you get well. Here's someone else saying, this sounds crazy, but I have hyperosmia and can smell mold fungus on people with this horrible. Absolutely. You know why? There are 2 mycotoxins that affect the olfactory nerve, the nerve that smells. And that's why you have hyperosmia. Once you treat the mycotoxins, that goes away. Isn't that great? All righty, folks. Well, have a wonderful rest of your week and be well. Thank you for listening. Bye-bye.